would I ever reject a drug that works?
Why would you prevent the opportunity for life-saving drugs to an individual?
That's a great question.
Why would you take a second look? That's
Why do you
exactly
think?
right.
I mean,
so I'm
what kind
to
of
take a second look at it.
What kind of perverse motive are you ascribing to me?
Mr. Kennedy,
if the drug works, we're going to approve it.
Let me just say.
Why would we hold back a drug that works?
Robert F. Kennedy Jr. came into office promising to clean up healthcare in America. He said he would go after waste, fraud, and abuse. He said he would end the cozy relationship between government regulators and the pharmaceutical industry. He said the FDA would approve drugs based on science, not politics. Senator Cortez Masto of Nevada came to this hearing with a Wall Street Journal article and a list of patients waiting for a cancer drug. Here's what she found when she started asking questions.
There are many concerns from oncologists in this country because under your administration, the life-saving drug for metastatic melanoma has not been approved. And in fact, you've been asked about this in hearings. And according to the article in the Review Journal, so I want to give you an opportunity to correct some of this, you said every panel within FDA, all the career panels, the career scientists who looked at the drug said it was not effective. According to the Wall Street Journal, that isn't true. The initial panel that reviewed Replimune's RP1 recommended approval. Secondly, when you sent a rejection letter, you parroted that Replume not only was it a one-arm trial, and all the people who were tested
I can't hear
also
you.
received a chemotherapy drug, so we don't know what the effect was. And again, the fact check, no patients in the trial received chemotherapy. Let me also reiterate, oncologists in this country, oncologists who treat patients with cancer, life-saving drugs, are asking and anticipated that this drug would be approved. There is no concern. And my question to you is based on the misinformation that you have said in previous hearings about this drug, are you prepared to change your position and actually move forward? And does the president understand that your decision that you're making is preventing oncologists in this country from treating cancer patients with life-saving drug?
Yeah, I mean, first of all, I had nothing to do with this decision. This decision comes out of FDA, and we trust the process there. And I've been told by Marty McCary that every panel that looked at that drug unanimously voted against it. And they voted against it because it does not appear to work, because the trial was a one-arm trial when the company was asked to do a two-arm trial.
But clearly that's misinformation.
I would ask yourself,
Mr. Kennedy, no, I'm going to ask you.
why would I ever reject a drug that works?
Why would you prevent the opportunity for life-saving drugs to an individual?
That's a great question.
Why would you take a second look? That's
Why do you
exactly
think,
right.
I mean,
so I'm
what
going to ask
kind
you
of,
to take a second look at it.
what kind of perverse motive are you ascribing to me?
Mr. Kennedy,
if the drug works, we're going to approve it.
Let me just say,
why would we hold back a drug that works?
I appreciate your comments earlier in this administration going after waste, fraud, and abuse. I think the healthcare fraud and abuse control program is important. I've been calling for more funding for it. I think it's essential that HCFAC has the dollars that it needs to go after in healthcare fraud. But let me ask you this. As we are fighting for funding for it to go after healthcare fraud, this president has actually pardoned at least 2 people convicted of healthcare fraud in just the first year of this administration. President Trump commuted the sentence of Lawrence Duran, who filed more than $205 million in false claims to Medicare by taking advantage of people seeking treatment for severe mental illness. Someone who defrauded Medicare for hundreds of millions of dollars. He no longer faces consequences and wiped out $87 million obligation in restitutions and fines. Have you talked to the president about the fact that he is actively undermining your agency's work to combat fraud?
The president doesn't consult me on his pardons. I don't know anything about that case. What I do know is that during the Biden administration, they purposely opened the door for hundreds of millions of dollars.
I'm not talking about the past, I'm talking about now. So that answers
yeah, but
no.
you're talking about one case that I don't know anything about. Why would I know anything about that case?
Let me tell you the reality in my state. Mr. Secretary, with respect to the Medicaid cuts. Effective May 1st, Boulder City Hospital in my state will no longer be able to support inpatient stays longer than 24 hours and will transform into a rural emergency hospital that, rather than retain the current designation as a critical access hospital. According to the CEO, it is because of the financial constraints exacerbated by the upcoming Medicaid provider tax cuts due to H.R. 1. 71 people will lose their jobs because of H.R. 1 and those Medicaid cuts. This is one of my rural communities. This is going to be devastating for so many, and this is the first that we're seeing in my state. My question to you is, what are you going to do to make sure that our rural communities aren't left in a healthcare desert without a reasonable way to access those services?
We're putting the largest investment in history into rural hospitals. There's never been anything like it. Prior to the rural health
Apparently that's not true for my rural hospital in Boulder City, and many other are concerned, so you don't have an answer for that either.
There's rural hospitals are closing at an alarming rate around the country long before President Trump got in here.
Thank you. Senator Daines.
Terry Kennedy, how are you? You know, in public life, we all make misstatements, all right? A couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. Do you want to correct that statement?
It's for the drugs that are on Trump RX.
I'm not talking about drugs. You said we pay the lowest prices in the world for prescription
For
drugs.
those drugs we do.
I'm sorry?
For those drugs we do, Senator.
Well, for certain drugs, but in general, would you agree with the Rand Corporation and every other independent survey that we continue to pay the highest prices in the world? You agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for
That's
the
right.
most common
I'm not
drugs.
saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
The most common drugs we do, or GLPs, or IVF drugs, or COPD drugs, or asthma drugs, for insulin.
Well, let me give you an example. For the cancer drug Opdivo, it costs $260,000 in the United States, costs $56,000 in Japan. We paying the lowest prices, et cetera, et cetera. Senator Welch made the same point. All right, the bottom line is, look, there are thousands of drugs out there. There may be a drug here or a drug there. We pay lower prices. In general, according to the Rand Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
For the most common drugs, we have the lowest prices.
All right. I am working on legislation which is not inconsistent with what Trump has talked about, and that is we should not be paying higher prices for prescription drugs than people in Europe or in Canada. Is that a concept that you can support?
Yes, President Trump wants this codified, and you have a lot more power than we do.
You're right. You're exactly right, and that is why I am going to be offering an amendment to the budget process right now, which would in fact codify what Trump is talking about, that the United States should not be paying higher prices than other countries around the world. Is that an amendment that you can support and get Republicans to come on board?
We will work with you, but in theory, that's exactly what we want.
All right, let me ask you another question.
Kennedy told the committee he had nothing to do with the cancer drug decision. He said every panel unanimously voted against it. The Wall Street Journal said the first panel recommended approval. He said no one would ever reject a drug that works. Then he said he was going to approve it. Cortez Masto asked him about the president pardoning a man who defrauded Medicare patients with severe mental illness out of $205 million. Kennedy said the president doesn't consult him on pardons. He said he didn't know anything about that case. He said one case. Boulder City Hospital in Nevada is closing its inpatient ward. Kennedy said rural hospitals were already closing before he arrived. 2 hours later, a different senator caught him on a claim he'd made earlier, that America now pays the lowest drug prices in the world. Kennedy said, "For those drugs we do." The cancer drug has not been approved. The $87 million in restitution has been wiped out. Boulder City Hospital has not reversed its decision. Subscribe and turn on notifications. The record, not just the promises. One case. That was the answer.